Welcome to today's video about early signs of glaucoma. Right now, as you're watching this video, you could be experiencing early warning signs of glaucoma and dismissing them as simple eye strain. By the time most people realize something is seriously wrong, irreversible damage has already occurred. Glaucoma is called the silent thief of sight because in most cases, early glaucoma produces no obvious warning signs until damage is quite advanced. But what if there are subtle indicators your body is sending you right now that you're ignoring? Today, we're exploring 12 early warning signs of glaucoma that often masquerade as ordinary eye strain. This information could literally save your vision. Stay with me until the end because what you're about to learn might be the most important thing you hear all year. All right, let's dive into the list of early glaucoma signs, starting with number 1, needing more light to see well. Have you noticed yourself turning on extra lights when reading or moving closer to the window to see clearly? You might think you're just getting older or your eyes are tired from screens. But research reveals needing more light to see well is actually among the most common complaints reported by patients with early or moderate glaucoma. A study published in Ophthalmology found that 58% of patients with early or moderate glaucoma reported needing more light as their primary symptom. Under dim lighting conditions, tasks that were once effortless now feel surprisingly taxing. The insidious nature of the symptom is that it develops so gradually you adapt without realizing something is fundamentally changing with your vision. You might blame it on poor lighting, aging, or fatigue, but your eyes could be telling you something far more serious. Research shows that even patients with early-stage glaucoma report significantly more trouble in low-light conditions compared to people without the condition. The reason involves how glaucoma affects your visual processing and contrast sensitivity, even before obvious vision loss occurs. If you've been cranking up brightness on devices and adding lamps throughout your home, it's time to pay attention to what your eyes are really trying to tell you.
Next, sign 2, intermittent blurring or hazy vision. You're working on your computer and suddenly everything looks slightly blurry or hazy. You blink a few times, maybe rub your eyes, and your vision clears up. Crisis averted, right? Not so fast. Intermittent blurring or hazy vision is commonly reported in glaucoma patients, and because it comes and goes, people rarely take it seriously. The transient nature makes it particularly deceptive. Clinical research has documented this as a frequent early indicator that patients often attribute to eye strain or fatigue. According to research published by the National Center for Biotechnology Information, 52% of patients with early or moderate glaucoma reported blurry vision as a symptom. When you experience blur from typical eye strain, it usually follows a predictable pattern related to prolonged visual tasks. But glaucoma-related blurring can occur randomly and may be associated with fluctuations in intraocular pressure that you cannot feel. The episodes might last seconds or minutes, and because they resolve on their own, you convince yourself everything is fine. Medical literature shows patients frequently report these visual disturbances months or years before receiving a glaucoma diagnosis. The tragedy is that during all that time, damage is quietly accumulating. If you're experiencing recurring episodes of unexplained blurry vision, this deserves professional evaluation. Next, sign 3. Difficulty adapting to lighting changes. Have you walked from bright outdoors into a dimly lit restaurant and felt like your eyes took forever to adjust? Or stepping out of a dark theater into sunlight leaves you disoriented longer than it should? Most people experience some adjustment with dramatic lighting changes, but what we're discussing is different. Some glaucoma patients report noticeably slow adaptation when transitioning between lighting environments, and this difficulty feels more straining than before. Research published in medical journals has documented that problems with light-dark transitions can be an early manifestation of glaucomatous damage. When glaucoma begins affecting your optic nerve, this adaptive capability can become compromised earlier than you might expect. You might find yourself hesitating at doorways, feeling uncertain or temporarily disoriented during these transitions. Perhaps you've started avoiding situations with dramatic lighting changes because they've become uncomfortable. These experiences are often rationalized as normal aging or attributed to being overtired. A systematic review published in BMC Ophthalmology noted that assessment of visual function among people with glaucoma is dependent on lighting conditions. If navigating between bright and dim environments has become noticeably more challenging or feels more exhausting than before, your visual system might be struggling with something more serious than simple eye strain.
Next, sign 4. Seeing halos or colored rings around lights. You're driving at night and you notice strange halos or colored rings surrounding streetlights and headlights. Maybe you see rainbow-like circles around lamps in your home. Your first thought might be that your windshield is dirty or your glasses need cleaning. But here's something critical. Seeing halos or colored rings around lights, especially at night, is considered a classic sign of potential glaucoma. This symptom can be associated with angle changes, corneal edema, or fluctuations in intraocular pressure. The Glaucoma Research Foundation states that if you see rainbow-colored circles around lights or are unusually sensitive to light, it could be a sign of acute glaucoma where pressure is high and the cornea becomes swollen, causing halos. The optical phenomenon creating these halos is often related to changes in your eye's internal pressure or fluid dynamics. However, because these visual disturbances can occur with other conditions like cataracts, people frequently misinterpret them as glare problems or simple optical imperfections. While you're assuming your night vision is just getting worse with age, actual pathological changes could be occurring. Multiple authoritative sources in ophthalmology emphasize that persistent or recurring halos require prompt professional evaluation, particularly when accompanied by other symptoms on this list. Next, sign 5, intermittent eye discomfort or pressure sensation. Some patients sense a subtle pressure, aching, or fullness in the eye that's difficult to describe and easy to dismiss. It's not severe pain, just an odd discomfort that comes and goes. You might press gently on your closed eyelid and feel a strange sensation of pressure inside. Because the discomfort is mild and intermittent, most people attribute it to fatigue, stress, or sinus issues. However, clinical documentation shows this vague ocular pressure sensation can be an early indicator of elevated intraocular pressure. This is particularly important. Glaucoma involves increased pressure inside your eye, but in most cases, you cannot feel this pressure building until it becomes extreme. According to Cleveland Clinic, some people experience subtle discomfort before more obvious symptoms develop, although this is less common. The discomfort might include sensations of mild eye pressure, occasional headaches, or slightly blurred vision. Medical literature distinguishes this from acute angle closure glaucoma, where eye pain is usually severe and sudden, making it obvious something is wrong. What we're discussing is the chronic, insidious form where discomfort is mild enough to ignore but persistent enough to be meaningful. If you've been experiencing this vague sense of pressure in one or both eyes, especially if it fluctuates, this warrants investigation.
Next, sign 6, headaches around the eyes or brow region. Headaches are so common that most people never consider them a sign of anything serious. You probably blame stress, lack of sleep, dehydration, or too much screen time. But certain types of headaches should raise your suspicion, particularly those centered around your eyes or brow region. Clinical research has documented that headaches can be associated with certain types of glaucoma, particularly angle closure glaucoma. According to Bright Focus Foundation, acute forms of glaucoma, when the drainage system suddenly closes and eye pressure increases rapidly, can cause headaches. The relationship between glaucoma and headaches likely involves the strain that elevated intraocular pressure places on ocular structures and surrounding tissues. You might notice these headaches developing after reading, computer work, or other activities requiring sustained visual concentration. A study published in PubMed noted that subacute angle closure glaucoma should always be considered in the differential diagnosis of adult-onset headaches. People take pain relievers, adjust their posture, or reduce screen time, never realizing their eyes are struggling with something far more serious. The headaches might be accompanied by a feeling of heaviness around the eyes or a dull ache from deep within the eye socket. If you're experiencing recurring headaches localized around your eyes or eyebrows, this deserves attention. Next, sign 7, frequent prescription changes. Have you found yourself visiting your optometrist more frequently because your glasses prescription keeps changing? Perhaps you got new glasses 6 months ago, but they already don't seem quite right. Maybe your contact lens prescription needs adjustment more often than expected. Most people assume their vision is simply becoming more unstable with age. However, frequent changes in your spectacle or contact lens prescription can actually hint at early changes associated with glaucoma, rather than simple refractive instability. Eye care professionals have noted that this pattern of needing unexpectedly frequent prescription updates can be an overlooked indicator of underlying pathology. The mechanism involves subtle changes in how your eye focuses light, which can be affected by pressure-related changes in the cornea's shape or emerging damage to neural pathways. What makes this particularly deceptive is that each individual prescription change seems perfectly explainable on its own. Your eye doctor might not even realize something unusual is happening unless they specifically look for patterns over time. You leave each time with a new prescription that temporarily solves the problem, never suspecting the underlying issue is progressive and serious. If you've been cycling through glasses prescriptions more rapidly than your previous history would suggest, this deserves investigation beyond simple refraction testing.
Next, sign 8, missing things in peripheral vision. Have you noticed that you occasionally bump into objects on your sides? Or perhaps people seem to appear suddenly from your peripheral field? Maybe you've started missing things in your side vision that you feel you should have noticed. Even subtle loss of peripheral vision is the hallmark of many types of glaucoma, and it's devastatingly easy to miss. Because your central vision remains sharp in the early stages, you might not realize anything is wrong until damage is quite advanced. Research published by the National Center for Biotechnology Information shows that patients often subconsciously compensate for these defects, turning their head more without conscious awareness. The Glaucoma Research Foundation states that blind spots in your side or peripheral vision are common, but many people don't notice because the sharpness of center vision is maintained until late stages. The brain is remarkably good at filling in missing information, making it even harder to detect these gaps. Clinical studies document that significant peripheral vision loss can occur before patients subjectively notice problems. You might attribute your clumsiness to being distracted, getting older, or simply not paying attention. Perhaps you've had close calls while driving, not seeing a car in your blind spot, or nearly colliding with someone at a doorway. Next, sign 9, slow constriction of visual field. Glaucoma doesn't steal your sight all at once. It's a gradual thief. With progression, your field of view slowly narrows, creating what's often described as tunnel vision. In early stages, this constriction may be so incremental that you mistake it for simply being clumsier rather than recognizing it as true vision loss.
The insidious progression is what makes glaucoma so devastating. Research literature extensively documents this characteristic pattern of gradual visual field constriction. Medical sources state that glaucoma usually starts with no symptoms and begins losing peripheral vision, and if untreated, can lead to complete loss of peripheral vision, and eventually central vision will be affected. Month by month, year by year, your usable field of vision gets smaller, but because it happens slowly and often symmetrically, your brain adapts. You unconsciously turn your head more to compensate. You might start feeling like spaces are more crowded, or that you need to be more careful navigating through doorways. Perhaps you've stopped playing certain sports, or have become more hesitant in crowded environments. These behavioral changes might seem like natural aging when they actually represent adaptive responses to genuine vision loss. By the time people consciously recognize they have tunnel vision, substantial peripheral field has been irreversibly destroyed. Next, sign 10. Light sensitivity or discomfort in bright light. Have you started reaching for sunglasses more often, even on moderately bright days? Does bright light make your eyes uncomfortable in a way that feels different from before? Some glaucoma patients report increased sensitivity to bright light, a symptom called photophobia that extends beyond normal discomfort anyone might feel in intensely bright conditions. According to Medline Plus Genetics, other signs and symptoms may include bulging eyes, excessive tearing, and abnormal sensitivity to light, particularly in early-onset glaucoma cases. The increased light sensitivity associated with glaucoma might have several underlying causes, potentially related to how damaged neural pathways process visual information, or to changes in how the pupil responds to light. You might find yourself squinting more indoors under fluorescent lights, or feeling genuinely uncomfortable in bright grocery stores. Perhaps you've started avoiding outdoor activities during midday. What's particularly problematic about this symptom is how easily it's rationalized. After all, many people have light-sensitive eyes for various benign reasons, and photophobia occurs in numerous conditions. But when this sensitively represents a change from your baseline, especially if accompanied by other symptoms we've discussed, it takes on greater significance. If bright lights have become increasingly bothersome and you find yourself constantly reaching for sunglasses, consider whether this represents a meaningful change. Next, sign 11, dry eye symptoms or ocular surface discomfort. If you're experiencing persistent eye irritation, burning, grittiness, or general ocular surface discomfort, you might assume it's simply dry eye disease or environmental factors like air conditioning or screen time. However, research has revealed a connection between glaucoma and ocular surface disease. A study published in Sage Journals found that some glaucoma patients tend to have more ocular surface disease, including dry eye and irritation. This association may stem from glaucoma medications that can affect tear film stability, or from coexisting conditions that affect both tear production and intraocular pressure regulation. The clinical importance here is that dry eye symptoms might be combining with early glaucoma, creating a confusing symptom picture. You attribute all your discomfort to dryness, never suspecting that an additional underlying problem exists. Perhaps you've been using artificial tears regularly, which provide temporary relief but don't address the bigger picture. The inflammation and irritation you're experiencing might be multifactorial, with glaucoma playing a role you haven't recognized. This is why comprehensive eye examinations are so critical, rather than simply treating symptoms in isolation. If you've been struggling with chronic eye discomfort that doesn't fully respond to dry eye treatments, or if these symptoms developed alongside other warning signs, you need evaluation that looks beyond the ocular surface.
Next, sign 12, episodes of transient vision disturbances. Occasionally, you might experience brief episodes of visual dimming where everything temporarily darkens. Perhaps you've noticed shimmering effects in your vision or brief blind spots that appear and disappear. These transient vision disturbances are nonspecific, meaning they can occur with various conditions, but they definitely merit inspection, especially if recurring. Clinical documentation shows that patients sometimes report these episodes months or years before being diagnosed with glaucoma. The frustrating aspect is how easily these symptoms are dismissed. They last only seconds or minutes, and then your vision returns to normal, so you convince yourself nothing serious is happening. Many people attribute these episodes to migraine even if they don't get headaches, or they blame fatigue and stress. Perhaps you've mentioned them briefly to your doctor, who didn't seem concerned, and you let it drop. But transient visual phenomena can represent temporary disruptions in blood flow to the optic nerve, or fluctuations in intraocular pressure that briefly compromise visual function. Medical literature acknowledges these as potentially significant symptoms that shouldn't be ignored. According to various ophthalmology sources, episodes of transient vision disturbances warrant further evaluation. If you're experiencing recurring episodes of any kind of temporary vision change, this needs thorough investigation. The temporary nature doesn't make them less important. So there you have it, 12 early warning signs of glaucoma that you might be mistaking for simple eye strain. From needing extra light and experiencing blurry vision, to seeing halos, feeling pressure in your eyes, getting headaches, and experiencing all those other subtle symptoms we discussed. Each of these signs individually might seem insignificant, but here's what you absolutely must understand. Glaucoma is called the silent thief of sight because by the time most people realize something is seriously wrong, irreversible damage has already occurred. Once your vision is lost to glaucoma, it cannot be recovered. However, if caught early, glaucoma can be managed and progression can be slowed or even stopped with proper treatment. The key is early detection, and that requires paying attention to your body's subtle warning signals. If you recognized yourself in even 2 or 3 of these symptoms, please schedule a comprehensive eye examination that specifically includes intraocular pressure testing and optic nerve evaluation. If you found this information valuable, please type "helpful" in the comments below. That really motivates us to create more important health content like this. Hit that like button, subscribe to our channel, and share this with someone who needs to see it. Thank you so much for watching.